Okay, co-occurring. So when it comes to the substance use, you see people with personality disorders, that's often a diagnosis in there, but you want to make sure that you're really careful. Is it separate from, did it predate the substance use? Is it a part of it? It very well could be. You also see a lot of anxiety disorder, trauma. You'll see a lot of these other disorders in there. And so it's really important, I feel, when I'm working with a client, I sometimes even get out my DSM and we talk about their symptoms. We talk about, which diagnosis is most appropriate, what really is happening for them. We also want to distinguish antisocial personality from criminal behavior. So recognize that some criminal behavior may result in distress or impairment in social functioning. Right? But you want to make sure that you're very clear that when I have an antisocial personality, okay, there may be criminal behavior that isn't, let's say, isn't noticed. But not all criminal behavior gets attention. And I'll point that out in a minute. So just being aware too, with substance use and antisocial, the diagnosis is not made unless the signs of antisocial personality were present in childhood. If both of them were present, you can make both diagnoses, but you want to make sure, again, doing that differential diagnosis, which one was there first. And of course, looking at the overlap. A lot of our clients who are, especially when you look at some of the methamphetamine things happening, they're engaging in a lot of antisocial behaviors. Doesn't necessarily mean they have antisocial personality disorder. So you want to make sure that you're able to make that distinction as well. Okay, some of the causes. So really there's three ways to view these disorders. You were born that way, you were not born that way and the environment did it, or you were born that way and the environment made it worse. And it's the last one that's the prevailing theory. And really a lot of disorders are viewed that way. We call it epigenetics, right? You have a genetic predisposition or foundation for a disease or a disorder, and your environment exacerbates it, right? Your environment makes it worse or not. And so that's usually the predominant theory, and it's very true for personality disorders. So there may be some etiological experiences, trauma, again, sexual abuse, physical abuse, neglect, being bullied. So really what it is, it's these life events and the emotional responses. And there may be some things to talk with your client about. And in particular, this last little sentence, change requires safety. But what if they don't know what safety is? Right? I've had clients that I remember one in particular, she had a new guy in her life. And I'm like, oh, great, another loser, but whatever. So this new boyfriend. And so she was telling me how amazing he is and how great he is and all these things. I'm like, okay, well, tell me more, right? If you really feel like he's the one and okay, tell me more. And really we had this conversation then about why him. And she's like, well, he's safer than anyone else I've ever been with. Oh, okay. Well, tell me more. What does that mean? And then I had to, good thing I didn't have coffee or something in my mouth. I might have spit it out. But she said, well, he's safe because he doesn't hit me in the face. Okay, so he still hits you, but not in the face, right? So she can still go to work. She can still go out in public and not have bruises all over her face. That was her definition of safety. He doesn't hit me in the face. So when you work with this population, particularly someone with borderline, you really need to be able to, what does safe look like for them? What does that mean? Because my job, they're not going to change or grow, even just someone without a personality disorder, but someone with trauma, someone with a substance use disorder, they don't change unless it's safe enough for them to be vulnerable and explore all the stuff. And so one of our primary functions is to make sure that they are safe. At least when they're in our office, they are safe. I'm not going to judge you. I'm not going to hold it against you. Unconditional positive regard, right? So what is safety? And that can be a clinical task, working through with them. What is their definition of safety? What does that mean to them? A little neuroscience. So I'm going to skip a lot of this just simply because of time. But the more we understand the brain and what happens in the brain, the more we're able to understand not just personality disorders, but substance use disorder, trauma, and really, so ASAM, the American Society of Addiction Medicine, in 2013, same year that DSM-5 came out, they revised their definition of addiction. And they revised it to say that addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. So primary chronic disease. Oh, not a moral failing, not a lack of willpower, a primary chronic disease. And part of that is because just as a whole, as a field, we're having a better understanding of the brain. We're understanding the areas of the brain, what they do, when there's impairments in that area, what happens, what that looks like. And so I think it's really important for all of us to have a better understanding of the brain and also teach that to our clients, right? Help them understand, hey, when your limbic system is fired up and you're in fight, flight, freeze, yeah, you're not going to be thinking very clearly. You're not going to be making good decisions, and helping them understand the why behind that. I'm big on educating clients because I feel like that's empowering them. I feel like that empowers them to do better for themselves. So I'm going to skip a lot of the neuroscience, but I just want you to have the information just so you have it. Now, this last little nugget here, though, I want to point out. So this functional psychopathy. So particularly with those with antisocial personality, there may be an adaptability and a strength. We tend to think of these disorders as like, oh, this is bad, but not really. So think about like a surgeon, right? If I'm on the operating table, I don't want my surgeon going, oh gosh, she seems like such a nice lady and she has 2 kids and I would hate for something bad to happen. I hope I can save her life. I don't want him thinking that. I want him saving my life. I don't really want him in touch with his emotions. So there can be this adaptability. And when you look at some of our careers, some of our professionals, right? Doctors, lawyers, CEOs, even counselors, to some degree, you will see higher rates of sociopaths in those fields because to some degree, I need to not be super in touch with my emotions. Right? If I'm going to be the CEO and like save a company, I need to not be worrying or sad that I stepped on someone's toes on my way up the career ladder. Right? And so again, when I mentioned like a kid in school, depending on their socioeconomic class, well, think about some of the criminals that we've had in our society, right? White collar. Okay. They're still being just as manipulative, just as deceitful, just as criminal as your drug dealer. They're just doing it in a different setting. So just going to throw that out there. There's also, so the reference on this slide, Dutton, so he wrote a book called The Wisdom of Psychopaths. One of the last slides, I've got a picture of the book. Fabulous book. If this is interesting to you, strongly recommend that you read it.